So, since it has been shown that tinnitus is related to abnormal neuronal activity in the auditory pathways, the idea came up that it would be possible to modulate this activity in the auditory pathways in the brain. So the brain is an electrical organ. That means by electricity and by magnetic pulses we can modulate the brain. The difficulty is that the skull is an isolator, so we need something to bring the electricity to the brain, and this can be done by the implantation of electrodes on the brain or by using the magnet in order to transport the electrical impulse to the brain. So what transcranial magnetic stimulation essentially does is that we use high intensity pulsed magnetic pulses in order to induce an electrical current in superficial brain areas. If you use this method over the motor cortex, you can induce a movement of the hand, for example. In a similar way, if you use this method repetitively, you can change the activity in the brain for a longer time. Let's say you stimulate a specific brain area for 20 minutes. This has a lasting effect on this brain area. And what was our idea is to use this method in order to treat tinnitus. So we exactly measured in every patient the increased or abnormal neural activity in the auditory pathways, and then we positioned a coil, a magnetic coil, exactly over this area and tried to influence this abnormal activity. And it turned out that in some patients this resulted in improvement of their tinnitus. So in the meantime there have been studies performed in several centers all over the world, and we know that this method is effective, but unfortunately is only effective in a subgroup of patients, and also in these patients it's not effective in the sense that the tinnitus is gone. It's effective in the sense that there's some relief from tinnitus, some improvement. Another problem is that normally we perform these stimulation sessions over 2 weeks, with one stimulation session a day, and we don't know exactly yet how long last these effects. So we have some indication that these effects can last 3 months. There are also studies which suggest positive effects for 1 year, but we still have to learn more how to perform this stimulation in order to make it more effective and longer lasting. Definitely, I think this is a method with a high potential. We just started to do it, and there are so many parameters which influence the outcome. So, like, for example, the stimulation frequency, the stimulation intensity, the exact localization, where to stimulate on the brain. That means we have lots of possibilities to optimize the treatment. So I would say the efficacy we have at the moment is not sufficient to offer this form of treatment as a routine treatment. But I think the treatment has a high potential to be further improved, and then I could imagine that it could become a routine treatment one day, at least for a group of tinnitus patients.